Good morning, Premier. Following up with you from this morning and our discussions about direct access. Thanks to everyone who went ahead and read through it and contributed to the conversation as to what direct access is and where we fall in line with that. So everybody pretty much got portions of it correct, but as we can tell, it's kind of open to interpretation and can be interpreted a lot of different ways. So that's the main reason why we wanted to go about it this way, so we can kind of see how people are interpreting it and then offer some clarification. So Premier's stance on direct access is pretty simple. Illinois is a part of direct access. Some people felt like Illinois was not a part of direct access, but Illinois is a part of direct access, but it is limited access. So patients can initially come to us and receive an initial evaluation or a screening or some amount of treatment without a prescription, but it's limited. So we can really only do that for the first visit. We do not need a prescription for the initial eval or for them to come into a screening. So when a patient calls, our goal is to get them in for an appointment. Whether they've seen the doctor, whether they have a script, whether they don't have a script, regardless, we are able to schedule the appointment and see the patient for that first visit, period. So we always want to be scheduling that first appointment, because scheduling the appointment and getting the patient in, if we do need to find them a doctor, we're going to have a better, easier, and hopefully be more successful at finding them a doctor after we've already started to build that relationship with them. B, if they don't need a doctor and they have a doctor, it's going to be easier for us to communicate with that doctor and explain why the patient needs physical therapy, in order to get that script after we have an initial evaluation in hand. If a patient's coming in without a script, the therapist should definitely, obviously, always do a good job in the evaluation, but maybe do an extra good job at the evaluation, because we know that we're going to be presenting this to a doctor as to why this patient needs therapy. So this is, we're kind of seeing a big shift in healthcare, where physical therapists are being noticed and respected and used as not primary care physicians, but physical therapists can help in a lot of different ways with a lot of different diagnoses in a more holistic fashion than a lot of people are taking advantage of. And so healthcare in general is kind of acknowledging that and trying to shift our procedures that direction. In doing that, it's our job to make sure that we're doing the best that we can. Again, in those initial evaluations, the therapist will get the medical history, get documentation on the injury, do some, range of motion, different tests, things like this that can all be sent over to the doctor. Here's what the patient came in for, here are the complaints, here's what we did, here's our plan of care, do you sign off? Bing, bam, boom, we have a script and a signed eval. And now we can go ahead and start treating for 12 visits. So the direct access isn't as ideal as it is in some states, but it does get our foot in the door. And I don't think that we're fully taking advantage of us being able to get our foot in the door. So 100% of the time, we're able to schedule an appointment without a prescription, as long as we have, some kind of diagnosis. The patient needs to have had some kind of diagnosis at some point, for us to start that process. Again, no doctor is necessary to start with us, and we would actually love to help people find doctors. So schedule the screening, let them come in and talk to the PT, and we can figure the rest out as we go. The other point that I wanted to make was that, in Illinois recently, there's been some changes in the legislation for physical therapists, and we will be shifting our direct access program more in line with Indiana. So it's looking like once this is formally passed, which is hopefully going to be in 30 days, we'll be able to treat patients without a script for up to 3 weeks. So that's going to be a big game changer for us. And it's really important that we start kind of practicing that now, getting the patients in, figuring out if they have a doctor or referring them to one of ours and getting that script. And, I know that people have complained about obstacles in getting scripts from doctors. Let's start having some more conversations about some of those challenges and not only pinpointing who the doctors are that we're having a hard time with, but what processes or changes can we make to make it easier for them? My understanding right now is we're faxing a script. I'm not even sure if that script is filled out or not how we want it. But we're sending, I believe, a blank script and asking the doctor to fill it out for the patient. And I believe that we're faxing it. So is us filling out the script and emailing it to the medical assistant going to get us faster results than faxing a blank script to the office? Different things like this. How can we change our processes to be more effective with the offices? And so if we can understand the pain points at the offices and why this is so challenging for them to get back in a timely manner, then we can help facilitate solutions for that in order to accomplish our goals faster. And so some of that might be when you do have a challenging case getting a script, just saying, hey, listen, I know that this is a really big pain. We're having a lot of trouble with this, in our company as well, and we're trying to find ways to make this easier for the doctor's offices. Do you have any suggestions? And that would be hugely helpful. So again, just to swing back around, direct access. Illinois is a part of direct access, but it is limited access at this point. We can see a patient, for a screening or an initial eval and some amount of treatment on that first day of service without a script. We just need a diagnosis. So that diagnosis could be on a piece of paper that was their appointment summary that you get after the doctor's office. It could be really any number of things. It doesn't have to be a prescription for physical therapy with a diagnosis on it. And we'll get them in for the first treatment. If they have a doctor, we'll start working with that doctor to get them their script. And if they don't have a doctor, we're going to work together to make sure that they get a doctor, and we can help schedule them an appointment with that doctor, and then, hopefully get the script. So I hope this offers some clarification. Again, all patients can be scheduled without a script, only need a diagnosis. Hopefully within 30 days, the governor is going to sign off on this new legislation for physical therapists that allow us to treat patients without a script for up to 3 weeks. So again, please make sure that we're kind of practicing getting these patients in, because we definitely want to be on the same page with this as these changes come into place. Having 3 weeks without a script for any patient, pretty much is, as Orlin mentioned, Maritza mentioned in these conversations, that could be a big help for us, a huge help for us. So thanks again for everyone who contributed. I loved hearing what you guys picked up from this. Again, all of you picked up, correct information. This is just offering some more clarification. If you still have questions after this, contact me via direct message, drop another note below, and ask for some more clarification, because it's really important. We're all really clear at what's the minimum amount that we need in order to be in compliance, yet still be able to see these patients. So I hope you all have a great day. You'll be hearing from me some more over the next couple of days. We will not be having a team meeting tomorrow because it's a short week, but you will be hearing from me with our scheduled meeting for next week tomorrow. So we'll have that date picked out and time picked out tomorrow, and you'll hear from us for next week. Happy almost Friday. Talk to you later.